This is a grossing tutorial video on how to process a skin ellipse, an oriented skin ellipse for melanoma. We're looking at the superficial surface of a skin ellipse. We've got the centrally located, irregular bordered, variegated lesion here. We've got the skin tip here. We've got the skin tip here. We've got orienting sutures here and here. We've got some previous ink or dye on the skin surface. This is where the surgeon has written on the patient prior to performing the excision. So, once again, tip, tip. We got a suture here, lesion here. Let's flip it over and look at the deep aspect. There's a lot of fat here. We've got some cautery artifact here. Let's go back to the superficial side. Now, as far as orienting the specimen, these sutures came already oriented. They said that the short suture is superior, the long suture is lateral. Sometimes these specimens will come with the sutures attached but no designation or no orientation to them. You may have to call the physician or the dermatologist. So in this case, it's short suture and long lateral. Now I can keep those like they are, or I can redesignate them, which I'm going to do in this case because our practice does it this particular way. So this is a short suture, superior, long suture, lateral. I'm going to redesignate these as 2 o'clock and 4 o'clock. So this will still be considered the 12 o'clock tip here. This will be 2 o'clock, and this will be 4 o'clock. I want you to take note that the lesion, if you look at the lesion, you look at the border of the lesion, look at the measurement of the lesion to the peripheral skin soft tissue margin, it's about 5 millimeters or 0.5 cm. Depending on the depth of the melanoma, sometimes they will do a much bigger excision with more margin to it. So I'm going to go over the clock face and how we designate these sutures per clock face in just a second. So let's continue on where I left off. So I wanted to, I took a photo of the skin ellipse and I pasted it onto this clock face here to kind of show you what I was talking about as far as sutures and whatnot. So this suture here was short superior. This suture was long lateral. So I redesignated this as 2 o'clock and I redesignated this as 4 o'clock. You probably get away with saying this is a 1 o'clock here and maybe even 3 o'clock, well, probably 3:30-ish, 4 o'clock here. Anyways, I designated these as 2 o'clock and 4 o'clock. I just wanted you to see how I got that, that clock face and how I redesignated those sutures per clock face. All right, so now coming back to the skin ellipse. Now, as far as inking goes, there's a variety of ways of inking these skin ellipses. The way we do it is we usually will, after we've done our designation of what the sutures are, we'll say the 12 o'clock to 6 o'clock side or the 12 o'clock to 6 o'clock peripheral skin soft tissue margin is inked one color, okay? The 6 to 12 o'clock peripheral skin soft tissue margin is inked another color, and then we'll do the deep aspect one other color, okay? That's one way of doing it. Kind of depends on the way your practice works. So another way you can do it is you can do just one entire hat. You don't have to do anything on the deep aspect. You can do the entire one half of the specimen, one color, and the other half another color, okay? So there's 2 colors. Some places will have you do 12 to 3 peripheral skin soft tissue margin one color, and then 3 to 6 another color, 6 to 9 another color, 9 to 12 another color, and then do the deep aspect another color. So it just really kind of depends on where you work and what your preferences are for your practice. So what I'm going to do for this case is I'm going to go ahead and just ink the 12 to 6 o'clock side green, the 6 to 12 o'clock side blue. And that's going to be just 2 colors. So the way we do this is flip the ellipse over like this. Always leave the sutures on until you're done with all your inking, okay? So let's do 12 to 6 green, okay? I may have said blue a minute ago, but let's do 12 to 6 green and then 6 to 12 blue, okay? Just like that, okay? And then what we're going to do is throw a little bit of vinegar on it. Let that vinegar make the ink stick. I'm going to dry this off and come back to it. Before we get started sectioning our skin ellipse, I want to show a few different ways of doing it. It kind of depends on which group you work for and what preferences they have for doing oriented skin excisions. So here's what we're going to do. We're going to actually section our skin ellipse from 12 to 6 o'clock and submit it in a sequential fashion. So we're talking about perpendicular sections to the long axis of the skin ellipse here. This is something very similar, except we're not going to submit this area or this area. We're just going to submit the skin ellipse tips here and here, probably in one cassette. We could differentially ink one end of it in that cassette. And then we're going to submit the remainder of the lesion, kind of block it out and submit the remainder of the lesion and the adjacent skin and soft tissue here. Here's an example of en face, where we take en face sections of the peripheral skin soft tissue margins all the way around the skin ellipse, and we submit them in a sequential fashion, beginning at 12 o'clock clockwise, and then we block out the lesion and show its relationship to the deep margin. Here's another example of perpendicular sections per clock face, where we just take these perpendicular sections of the clock face 12, 1, 3, 6, 7, 9, and 10. Once again, this is just kind of dependent on your group and what practice you guys work for. So the last thing I was doing, I was inking the ellipse. So as you should recall, I inked the 12 to 6 o'clock side green, the 6 to 12 o'clock side blue. And then what I went ahead and did is I went ahead and put a little bit of red ink over the 12 o'clock tip. And you may or may not want to do this, especially if you're a beginning PA, you may want to do it, because sometimes I've seen in the past the sutures are taken off and then the specimen is knocked around or moved around, and then someone doesn't remember which was the 12 o'clock tip. So anyways, so I'll put a little bit of red ink on the 12 o'clock tip. Once again, 12 to 6 green, 6 to 12 blue. Here's our lesion. And what I'm going to do is I'm going to section it from 12 to 6 o'clock and submit it sequentially. And what I like to do is I like to cut from the soft tissue side first. And so we're going to do our tip here, okay? And then I'm going to do a couple more sections. Stop right there for a moment. And then here's our cassette. And what I like to do is I'll put the tip down like this. I'm sorry, not the tip down, but the cut surface down like this. Some places, they may have you put the tip down first, but for our practice, our histology department, we put the cut surface down. Okay, and if it's positive, on their slides, they'll end up cutting through the entire block, or the remainder of the block, and to make sure that is a true positive margin. Okay? So, and then I'm going to put this section in here like this section here like this, and then what I'm going to do is I'm going to put a sponge on top of that. Some people put sponges on the bottom and then put a sponge on top. I like to just put it on top like this, and what you can sometimes do is you can put your scalpel blade in there to kind of make it flat, and then you can just close it like that, and voila. So here's the first block. Remember, we're sectioning this from 12 to 6 and submitting it entirely, okay? I'm going to do one more block. And I don't usually talk about the cut surfaces on skin ellipses. It's really a histological diagnosis as far as the depth goes. or grading. Okay. So for something like this, these cut slices here, I'm not going to put a sponge on top because I want it to fix well. And by me putting the lid down, they're not really going to flip over or anything. Okay. So I'm just going to continue on, and thanks for watching.